Welcome, everyone. Look, if you're a parent, getting the news that your child's nearsighted prescription has gone up again, that can be incredibly stressful. It's totally natural to feel a bit anxious and want to jump right in and find a treatment to just fix it. But before you start picking out a product, you really need a solid starting point. So, in this explainer, we're going to navigate childhood myopia in Cincinnati together. The goal here is to cut through the noise, ease some of that anxiety, and give you a really clear, structured pathway to finding the best starting point for your child's vision. All right, let's dive right in.
So, here's our roadmap for this explainer. We're going to cover understanding your child's vision, exams versus dedicated consultations, preparing for your visit, measuring the eye's growth, and finally, your simple three-step pathway. Starting off with Section 1, understanding your child's vision and what to expect from a clinical evaluation.
Now, the ultimate goal of a clinical evaluation isn't just to hand you a piece of paper with a new glasses prescription and send you on your way. No, the real goal is for you to leave that clinic fully understanding exactly how your child's eyes are changing, what specific metrics the doctor can actually measure, and what the logical next step should be for their long-term health. But when a kid's vision starts changing during those school years, this is a question we hear from parents all the time. Hey, is a school screening enough to diagnose myopia? And it's a completely fair question, right? I mean, for a lot of parents, these screenings are the very first time they're even alerted to a potential issue.
Well, here's the deal. School screenings serve a fantastic purpose. They are a super helpful first alert system to identify kids who might be at risk for vision problems, and we absolutely want kids participating in them. But they aren't a substitute for a comprehensive pediatric eye exam. Clinical guidelines tell us that an in-person, comprehensive evaluation is absolutely vital because it's really the only way to make an accurate, definitive diagnosis and establish a true baseline for a condition like myopia. Think of the school screening as the smoke alarm going off, and the comprehensive exam as the firefighter actually showing up to assess the situation.
Moving right along to Section 2, exams versus dedicated consultations, and knowing the difference between the two.
It is incredibly helpful to know exactly what kind of appointment you are walking into. So, a comprehensive eye exam focuses on your child's overall eye health. This is where they check for things like binocular vision issues or eye diseases, and they establish that initial baseline vision prescription. Now, contrast that with a myopia-management consultation. This is a separate, dedicated visit. It is strictly focused on tracking the progression of the nearsightedness and creating a tailored treatment plan to slow that progression down. Basically, you generally need that baseline comprehensive exam first before a dedicated consultation even makes sense.
Okay, Section 3, preparing for your visit and the information you should gather beforehand.
All right, so here is your pre-visit checklist. First, definitely grab their current glasses and any past eye records you have. Knowing the exact age their myopia began is a massive indicator for future risks, so having that timeline is huge. Also, make sure to jot down your family's history of nearsightedness and whatever medications they're currently taking. And finally, take a quick inventory of their day-to-day lifestyle. How much time are they spending outside playing versus, staring at screens? Clinical data actually shows these environmental factors play a massive role in eye development.
Which brings us to Section 4, measuring the eye's growth and looking beyond the prescription.
You're going to want to remember this term, axial length. In plain English, this is simply the front-to-back length of the eye. So why does this matter? Well, as myopia progresses in kids, the eyeball actually physically stretches and elongates. So this vital metric provides crucial physical growth information that a standard prescription on its own just can't fully capture. It literally tells the doctor exactly what is happening to the structure of the eye.
Now, to get this specific data, you need advanced technology. For example, Eyecare uses a highly specialized instrument called the Topcon Maya. This device helps doctors precisely measure that axial length we just talked about so they can track eye growth trends. But it also provides corneal topography, meaning it maps the exact shape of the front of the eye. And that is an absolute must-have if you're considering treatments like Ortho-K, which are those special contact lenses worn overnight to gently reshape the eye.
Now, if your child gets this measurement and the number seems high, I want you to take a deep breath. A single measurement is merely a starting point. It's a baseline. It is not some crystal ball predicting their future. What doctors are really looking for are growth trends over time. Comparing these measurements at follow-up visits is what truly allows your doctor to make safe, effective clinical decisions.
Because an effective myopia plan looks at the whole child, not just their eyes. It's kind of like a giant puzzle. Yes, doctors measure progression rates and corneal shape, but they also have to look at your child's maturity and their sports schedule. For example, if a treatment involves wearing daily contacts or doing strict nightly eye drops, Well, that requires a really realistic look at your family's ability and caregiver involvement to actually stick to that routine. And I want to emphasize this next point super clearly because, honestly, it should take a lot of pressure off your shoulders. Not every myopic child automatically requires a specialized intervention. Sometimes standard glasses and just monitoring the situation are perfectly appropriate. And furthermore, the absolute newest product on the market, it's not automatically the best choice for your specific child. The right choice is always going to be the one that fits their unique clinical profile and your family's lifestyle.
All right, bringing us to Section 5, your simple 3-step pathway and what to do next.
So here is your simple 3-step pathway. Step 1. Schedule a comprehensive pediatric eye examination to establish that baseline and check their overall eye health. Step 2. Work with your doctor to review the child's progression and their specific risk factors. And Step 3. Only proceed to a dedicated myopia management consultation when the child pattern of progression actually warrants it. It really is that straightforward.
If you are in the Cincinnati area and you're ready to take that next step, you are always invited to read the complete Cincinnati Parent Guide, which is linked in the resources, or simply schedule a dedicated myopia management consultation at Eyecare to discuss your child's unique pattern. Just a quick note, this educational explainer was prepared directly from clinical resources reviewed by Dr. Rawzi Baik at Eyecare, which is an independent optometry practice located right in Cincinnati's Hyde Park neighborhood. And finally, please remember that this explainer is strictly for educational purposes. Individual eligibility, risks, and recommendations always require an examination by a qualified eye care professional. So before we wrap up today, ask yourself, do you know your child's current baseline, or just their glasses prescription? Because understanding the difference between the two is the very first step toward protecting their vision for life. Thank you so much for joining me for this explainer, and we'll see you next time.